Hello, everyone, and thank you for joining us for episode 10 of the League Trauma Podcast. Today, we will be talking about what it takes to be a sports PT, as well as what a day in the life of a clinical director looks like. We are joined by none other than Dr. Andrew Bucknor. Dr. Drew is a clinical director and performance physical therapist at the Gambrills location for Rehab to Perform. Dr. Drew is well experienced with leading others. Having been a clinical director for multiple well-known companies, he has a passion for mentoring others while continuing to learn from those around him. He provides a great insight on what it takes to be a great physical therapist. We are super thankful for Dr. Drew and all the time and information he shared with us today. So if you ever cross paths with him, please let him know what an awesome PT and person he is.
I am Dr. Andrew Bucknor. I go by Dr. Drew. I work for Rehab to Perform at the Gambrills location in Maryland. I've been a PT for 12 years coming up. So in July. So I've been around the block a few times. I grew up here in Maryland, born and raised. My family's Jamaican, and so I definitely love travel and things like that. But in relation to my upbringing, I grew up, like I said, in Maryland, went to University of Maryland, College Park, and then I went to Temple University for PT school in Philly. That was in 2012 when I graduated, and I've been doing my thing ever since then, primarily working with like the sports side of things, and then now currently more of like the weekend warrior, the fitness related adult, and that mindset.
It's really cool.
Yeah.
My first thing is, for someone who may not know, let's say an athlete, why is it important for an athlete to seek out a sports physical therapist as opposed to just a regular outpatient PT?
Oh, very good question. So I would say the mindset of a general ortho PT or somebody who may not necessarily have the experience or the education is important for the connection one. So understanding what a sport entails, what movement patterns, what prerequisites, so to speak, that somebody's going to need to return back to sports safely. And I think that's all of our mindsets, getting back to whatever activity or whatever sport that individual wants to return to, but not only safely, but are they prepared? And so preparation, I think, is key. Repetitions, exposure, all those things go into factoring how well somebody's able to put together a plan of care for somebody who is able to return to that sport. And then seeing a sports PT, and hopefully that individual has the educational background and not just saying they've treated a couple athletes here and there. They've actually had some years under their belt, or they went through residency, or they had some sort of experience that have given them a little bit more knowledge based on that population. You see it too many times where somebody's being thrown back onto the field or the court too soon, just from a pain perspective. So 0 to 10 pain, and strength looks good from a 5 out of 5 manual muscle test. Maybe they did a little bit of hop testing, or maybe they did some cutting drills here and there, and they look pretty good. They said they felt good in practice, and they were like, "Oh yeah, you're cleared." But I think it goes more into like objective findings, and now you're seeing a little bit more of that in the PT world, of being a little bit more intentional with how we do testing.
Yeah, it seems like you guys are doing a great job over there at Rehab to Perform.
Yeah, trying.
The facilities all look amazing too. I think that's another key factor, having that turf in there and having the space for the athlete to actually be able to do the things that their sport demands versus being in a small outpatient setting and not really having the space or the tools for that. So
For sure. Huge.
I got a question. So along those same lines, did you find most of your education in that sports field from your personal experience through maybe an injury you had and kind of how you dealt with the pain? Or have you found yourself more just looking more at the literature and kind of what your peers are learning from?
Yeah, so I think that's twofold. So the experience is personal. Just with and y'all may know just from my IG page, with my progression from the patellar tendon repair about almost a year and a half now, showing the progressions from when I started to now, and understanding what it takes from a foundational, setting the baseline, building the base, to now we're trying to do plyometrics, more athletic, more strength, to where I'm at now and following that spectrum. But then going into the educational piece, understanding, what it takes to to actually put together a plan of care. It's one thing when you're immersed in it and you're involved. And I think it made it easy for me as a PT that I'm able to, put together a program for myself up until this time being with that treatment for my injury. But I think as individuals getting into the space of sports PT or being in that world, I think educating yourself, one, just on the basics, I think that's huge. I think we hear athletes, we hear sports, and I think we get so hung up on, okay, we got to make things high level, we got to make things difficult, we got to make things challenging, and I think it's more to it than that, especially in the beginning stages. And I think we fall away from that, especially if you're an inexperienced clinician or somebody who hasn't been exposed to that population.
I got a follow-up question. You bring up a great point, like the basics and not falling into the trap of like what you see on social media. You kind of have any like words of advice for like a new grad who wants to make their mark in the world, but they also don't want to like get caught up in that social media aspect that maybe not doesn't translate as well to the clinic?
Oh man, yeah. So social media has definitely changed the game in our field. I remember IG popped off. I was around like 2010, 2011, and everybody was just using it just from a personal standpoint. And now, finding ways to make money from it, and to monetize it, but then also just to put content out there and just to educate the masses. I would say you need to find ways that are going to be able to attract your audience, one, but do it in a way that's authentic. And I think that's one thing that you'll see a lot of gimmicky type of trainers or healthcare professionals out there that kind of just doing things for clickbait. And that I understand from a monetizing standpoint. But at the same time, what type of information are you putting out there, and how well is it received by that audience? And I think just adding that educational tools, like, these things may not look, fancy like, some of the other people that are putting content out there, but these are, 2 or 3 things that are going to be beneficial for you to start. And then here we can progress here and there. But yeah, I would say the advice would be to keep things simple to start and then build your base from there. And I know it's hard to build an audience from some of the basic stuff because it doesn't have that wow factor, but find ways to engage. I think there's multiple ways. And I think y'all do a good job of that at League Trauma, being able to do that. I think sports injuries and understanding that, you don't have a lot of people explaining those things to the masses.
Thank you very much.
Yeah.
Could you take us through a typical work week for you?
Oh, yeah. So a typical work week. So I am currently the site director at my location. It's been about a year, almost a year and a half now. And so Mondays and Wednesdays are 7 to 4 o'clock. Tuesdays and Thursdays are 10 to 7. And then my Fridays are short days. So I work 7 to 11 a.m. And so Mondays are usually, getting the week started. I'm trying to figure out, what my schedule looks like for the entire week. But then not only mine, I'm looking at my team. So I look at, productivity in terms of, how many people are coming into the clinic, how many people are we losing, whether they're graduating or whether somebody's becoming non-compliant, reaching out to staff members as to, our game plan for the week and what our focus is going to be. And then as the week goes throughout, there's different events, whether it's community related, whether we're doing things within high schools. So even like, for example, this week on Wednesday, I have a mobility type training thing with the Archbishop Spalding High School hockey team. So I'll be doing that Wednesday afternoon. And then I will be meeting up with Excellence in Fitness, which is a gym, personal training gym, on Friday, just to talk shop about manual therapy techniques. So I have different things that we cater to within the fitness world, within the community, and then even schools, youth sports, things like that are lined up usually throughout the week. And then of course, treating patients. So if I'm, treating, I definitely try to provide some level of quality of care when it comes to treatment. I want to make sure each session is personalized. I want to make sure I'm giving my undivided attention to each individual. And then also I'm a CI, so I'm a clinic instructor. So I have a student right now who's been here for about 3 weeks or so, and I have a second student starting tomorrow. So I'll have 2 students at the same time, which is kind of a different world for me. I've only had one student at a time, maybe a couple weeks overlapping, but this will be a nice change of pace where I'm able to see just a different side of how I'm able to navigate. So between treating, being a site director, being a clinic instructor / mentor, I think there's a lot that goes into each week, but I think I thrive with all the different hats that I have to wear.
Yes, sir.
Yeah.
So I'm actually we're in a full-time clinical right now, and I'm actually one of two students underneath one's clinical instructor. So I was just wondering, I guess you haven't been in the situation yet, like you said, but do you have any advice for students if they are in that situation, how to just not overstep and also make the most of their clinical education?
If you're saying there's two at a time.
Yeah, if you're one of those two students in
Yeah.
underneath CI.
Yeah, I think it's not just the student's responsibility to have some level of engagement. I think the CI needs to find a way to make sure both students are productive. And I think I already have some ideas as to how I'm going to do that. But I think as a student, if you are matched up with somebody else at the same time, I think you need to either reach out to the CI and have them give you different types of items to focus on throughout the week, and whether that's objectives or things that y'all had goals to work on the weeks prior, or if there's certain topics or like subtopics of areas that you aren't necessarily well versed in. I think those might be a focus. But then I also utilize my other student. So if they've already been here for a few weeks, to help teach my other students. So it almost becomes like a mentorship of a mentor within a mentorship. And I think it helps students become a little bit more vocal. I think sometimes they get very timid and they're just kind of like just watching and observing. And then you have other students who are just, in there. And I think sometimes those students who are a little bit aggressive, so to speak, they may need to take a step back and become a teacher in that moment, in a sense. And I think we all want to learn from each other. I always tell my students when they approach their last internship, hey, I'm learning from you. You're learning from me, and we'll make this collaborative. I don't want you to look at me as like, okay, I'm the boss and I'm telling you what to do. It's more of a, hey, you know what? I never thought about that. Hey, I never learned that in school. Mind you, I've been out since 2012. So there's a lot of information that I haven't been able to grasp. There's so much research out there and so many different things happening since then. I can only, hold so much, but students bringing in fresh ideas and fresh looks, I think is super helpful. And then just having the students collaborate with each other. I think with plan of care, I usually have not only my student, but students of other CIs and say, hey, take a look at this patient. I know we haven't really had this many ankle and foot type of diagnoses or pathologies. Hey, check this out, see what plan of care y'all can come up with, and then we can review it. I think collaboration is going to be huge when it comes to having two students. Yeah.
Yeah, that's kind of what my CI is doing right now. Is she's like letting me have my patients and the other student have her patients, and then we kind of group if there's ever like a patient that's more complex and less like standard. And yeah, lots of collaboration, like you said. So that's a great point. Thank you.
Huge. Yep. You're welcome. For sure.
So I saw that you're a certified orthopedic manual therapist.
Yes.
When did you acquire that, and how has that like changed your practice in any way?
Yeah, so that was in 2017 is when I acquired that. So I was working with ATI physical therapy for about 9 years or so. And they were allowing us to collaborate with Evidence in Motion, or sorry, not Evidence in Motion, the Institute of Advanced Musculoskeletal Treatment. So IAMT. And they had a COMT cohort that started in 2015. So it was over a 2-year span, 8 courses. We sit for the exam. We had the written part of it, and then we had the psychomotor section of it as well. Ended up passing that, and I think I had more knowledge of ways to treat from a hands-on or manual therapy perspective. But I think at the same time, I don't think it necessarily changed the way I treated. Just knowing that manual therapy is only a small section or small area in plan of care or treatment that is actually going to be beneficial for the patient. And not everything that we learned during that COMT, all the COMT courses made it different in the sense that oh, this is an advanced technique. This is superior to anything we learned in school. I think it just gave me different ways to look at things or different ideas. The only thing I think it changed was the way I had a systematic approach, so to speak. So they really hammered in um, the order at which you're really doing things, and it did make sense because it put me in a way of becoming second nature with treating and not just being so haphazard with, okay, I'm going to do this test now. Oh, dang, I forgot to do this. Well, let me do this. It really broke it down where it made it systematic and um, made it easy to navigate patient to patient. And I think at that time I'd only been what 5 years. By the time I finished it, I was about 5 years out from PT school. So it definitely helped to hone back in on that skill because I think coming out of PT school, you have that mindset of, okay, special tests, like this diagnosis, I know how to do this. You go by the book. But I think I was kind of all over the place in the first couple of years of after PT school, that this cohort really helped me kind of get back into where I wanted to be from a quality standpoint.
That's a good point.
Yeah.
And yeah. So the students that you have in there in your clinic now, or just in general, do you think their manual techniques are similar to what you learned throughout that course, or are you sort of like, I don't know, leading them in a way to take that more systematic approach? Like,
yeah. So I would say the stuff that my students show me, because what I try and do with every student, I try and go through every body part. We break down examination, red flags, what objective measures I would normally do, and then go through palpation, hands-on, manual type treatments, and we would go through that, and then potentially plan of care from like a exercise prescription. And we do that with every single body part, starting from low back down to the feet, and then we go neck down to the extremities, to the fingers. And so when we do that, I see different ways that students have learned in school, and then there's just other ways that they just completely have not. And I think that shows the difference in faculty too at certain schools. They're like my school at Temple, we were heavy on ortho, especially the manual therapy component. And so for me, that was something that I was drawn to, and I feel like I have a good grasp from a manual therapy standpoint. But when it comes to the advanced techniques, I don't necessarily show a lot of that or utilize that in my mentorship and coaching. I think I've dialed that back in terms of focusing on the basics. I think if you're really good at the basics, you can be efficient with treatment. Now, I will show students some other techniques if you feel like what you've exhausted every single mobilization manual therapy technique that you can think of for this area, and you don't really notice any change. Hey, try this out. This might be a game changer, or this might be something that gets them over that hill. But in general, I would say there's not a huge discrepancy in what I learned in school and what y'all have been coming to me with. But there are a couple things here and there that I feel like should be taught. But for the most part, y'all got it. But also, sorry, disclaimer, I would say the students that I've had have been dealing with the pandemic. And so there's not that same hands-on level of training that's been going on with schools too. So that part has also been a disconnect.
Sweet. Thank you.
Yeah, for sure.
Switching gears a little bit, you mentioned the Archbishop Spalding kind of treating their team. So how different is it to treat like the one-on-one care that you're used to, and then kind of transfer and translate that to a group setting?
Yeah, so that's something I've had to adjust. So coming from ATI physical therapy, I never really had any so outreach or community driven type of training or mentorship. So I think going to these different high schools and making it more of like a group setting type of education has definitely made me become a little bit more confident in like public speaking, one, and then becoming more I'm trying to think the word, connected, I should say, to just the high school students in general. I think I have to like really rewind, almost talking about 20 years ago when I was back in high school, and understanding like, okay, we talk about social media. What keeps them engaged? They're here for their sport, but then they may think like this dynamic mobility training, recovery type of tips aren't necessarily going to be beneficial for them, or they just think, they're above that. Why are we doing this? And I think finding ways to grasp their attention and really engage makes it a little bit more challenging. But I think having the coaches there and having some of the other staff within the schools there is helpful with trying to navigate that. But I don't think it's too different than when I'm in the clinic, because when you're in the clinic, I mean, it's just one person, but when you're in a group setting, everybody's doing the same thing too. So it's really just trying to navigate, okay, pinpointing form, pinpointing, efficiency and movement and how they're doing with a certain activity. So, but yeah, I don't think I find it drastically different, but that's a good question that you bring up, because I never really thought about that transition from, one person to a group setting.
Yeah, I know, because I coach at the high school level as well, and it's like a total difference when I'm in the clinic versus when I'm trying to like appeal to a whole wrestling team or like my position group in football. It's like I'm just totally different teaching styles, and I'm trying to adjust and kind of learn as I go. So yeah, it's a great point. Just kind of just focus on the technique and fundamentals in that group setting. It's a great point.
Yeah. Where do you coach at?
So I coached down in Salisbury at Parkside High School.
Okay.
Yeah,
Cool.
football and wrestling there.
Is wrestling your sport?
I played football in college, but I feel a bit more confident probably in coaching wrestling right now. Yeah.
Okay. Dope. Nice. That's what's up. Good stuff.
Next question I have is, how do you help athletes overcome that mental barrier or fear of re-injury in the clinic?
I'm trying to think way to describe this. So overcoming fear, the mental component, I think it's a topic that's not really discussed as it should be, or as much as it should be. I can go from personal experience. I definitely had a couple breakdowns throughout my journey where I had to kind of hit reset and understand, like, hey, Drew, it's okay. Like, you take it one day at a time. Reach out to your support systems, reaching out to family, reaching out to friends. Find somebody that gives you a sense of comfort, but also gives you a sense of understanding as well. I think as physical therapists, people always talk about, okay, where I hate the term where they were like, oh, you're a physical terrorist, or I'm trying to think what's the other words they use, but we have a softer side to us. And I think that side caters to the mental, the fear avoidance, the psychosocial, all those other factors that can make or break a patient, to be honest. I think that's an area that I love to immerse myself into, because I know that's an area that almost puts them in the best position to be successful outside of PT. And with R2P, we educate the autonomy, the independence, the confidence to get back to whatever sport or activity. And that goes along with the mental, the fear avoidance, because a lot of individuals come in and they're like, what, I'm scared, or I hurt myself, deadlifting, or I hurt myself, reaching overhead or something like that. And really trying to give them a sense of confidence as they go session to session. And I think y'all may not know the 6 principles that we have within R2P. So the 6th principle is cultivating self-optimism. And so I think that goes along with the span of, day one to when they graduate. And I think the self-optimism piece is huge when it comes to building confidence. And that being from day one will eventually become greater and greater and greater. And by the time they're finished, they won't even feel like they need you. They feel like they have all the resources, they have all the connections that they need in order to be successful moving forward. But I would say, having that empathy, and then having the understanding for patients, and having that sit down, that one-on-one, I think gives them a little bit more confidence, gives them a little bit more insight to, what things could really be like in the future.
Cool. Thank you. Yeah, it's really helpful, because I obviously plan on working with athletes in the future, but never had the opportunity to treat an athlete yet. I'm in a outpatient ortho, right?
Okay.
I haven't seen an athlete yet. And then my part-times both were in the hospital. So
yeah. So even with your ortho experience, are there any patients that you noticed that they're struggling mentally or having that fear avoidance component?
Yeah, I think so for sure.
Okay. And then have you found it difficult to navigate with that, or do you feel like that's just there's no issues with them progressing in terms of building confidence?
No, I think I definitely had difficulty navigating with that for sure.
Okay.
Being able to like let them know that it's okay and like you said, take
Hmm.
the step back and all of that. It's just tough when you see somebody going through that and you want to know what to say in the moment, but also don't
Yeah,
want to mess anything up. So yeah,
for
it's
sure.
continuing to work on.
Yep, for sure. It takes time. Yeah, I would say experience will put you in a better position. But yeah, as long as you're recognizing it now, I think that's huge. Yep.
Thank
We
you.
have 5 more
Yeah.
minutes left. I'll probably shoot off one more question if that's all right, and then we
Cool.
can kind of
Yeah.
regroup. So just going back to being a clinical director, how do you find yourself kind of building that camaraderie within your location, within your team? And if like you have meetings, do you have like special educational settings where like people are teaching each other? And you just talk a little bit about how you run your clinic.
Yeah. So I think just within the realm of R2P, we don't necessarily have like set um, team meetings, and I find that to be beneficial. I think when I used to work for ATI, we would have like set monthly meetings, and they just felt so forced that they didn't feel authentic, and you're just kind of like saying whatever in the moment. And I don't think that necessarily translates to productivity, translates to your team really buying into the system. I think with Rehab to Perform, it's a little bit more open, and I think give the I give the positive atmosphere, the positive energy towards our clinic, and I think that setting the example and setting the mood always has the team following you. And that's what I found throughout my course of 12 years, and about 8, 9 years of being in a clinic director position or a site director position. I think in leadership, if you lead by example, it makes it easy. And when you have a team that buys in, that makes it a lot easier. And so I'm grateful. And I just told my team the other day that, I'm grateful for y'all and how you've been able to handle change, how you've been able to handle, just the new year and been able to help grow this clinic. And this clinic's only been open a year and a half right now. And I came in at the half year mark. So it's been about a year that I've been really working with the rest of the team and really building. But I think if you look at who you decide to bring in and being a part of the interview process, being a part of the hiring process, I think that helps. If you're bringing in individuals that are, negative or don't necessarily, or they're kind of in the middle too. Some individuals who are, we call them gray. So I don't know if y'all been seeing some of the things that have been going on with R2P, but Lead 'em Up initiative has us being a part of the green team, and green and being, vibrant, dynamic, somebody who brightens the room, somebody who brings the energy every day. And I think that's something that I try to do with my team, just like I said, leading by example. And I think everybody else follows suit. Bringing that energy gives patients hope, make them, happy in a place that may not feel so happy, heading into it. And so I think if your team is happy, then patients are happy. And then, everyone wins in that situation. So I think as a site director, leadership becomes easy when your team follows suits with just your energy and mood, and everything else just makes it a lot more seamless as time goes on.
Awesome, thank you. So we got about 2.5 minutes left. Do you have any
Yeah.
questions for us or any closing remarks?
Yeah. So how did y'all come up with the idea for League Trauma, or who was the innovator?
So it kind of started during it was our winter semester. We were only taking visceral anatomy, so we had so much time in our hands. And we were like, man, what can we do? We were already we were in the gym all day. We were like, what else can we do to like take up some of our time and like combine what we've been learning in the classroom. We just finished up
Mm-hmm.
with anatomy and combine all that and then maybe start putting content out. So we were like, let's just break down sport injuries and see where
Nice.
yeah.
Cool. And then how many people are part of the team? Because I've seen other individuals. I don't know who they are, but
Yeah, so there's about 5 of us now. Josh
okay,
and I were the only ones on the team for a long time, probably
got
about
it.
like 8 or 9 months, and then we wanted to push out daily content, so we figured we didn't want to stress ourselves and overwhelm ourselves with on top of our studies, so we decided it was it was time to build the team up. So yeah, we've got 5 members now. And we're having a lot of fun.
That's what's up. That's
Yep.
good stuff. And then Josh, I'm just looking for that easy vert training program. I got to get my bounce back.
Come on, man. I got you.
Nah, I'm serious. I'm gonna hit you up. I need that joint on the side.
Bet that. I got you, man.
I got you. All right, appreciate it.
Yes, sir.
I think that's all the questions for me, though. I appreciate y'all having me on here. This is dope.
Yeah, man. Thank you very much for joining.
Yeah, definitely. Y'all keep doing big things. I appreciate y'all.